Dr. Feng, what are the most common symptoms that are associated with women who are having a reaction to their breast implants?
Here are some of the most common symptoms: fatigue, muscle and joint pain, especially muscle pain in the neck and shoulder area, in the back, because that's a direct effect of the implants. Another direct effect of the implants is respiratory difficulty. One of the common symptoms that I hear is that I cannot do some of the exercises that I was able to do before implants. Number one, I cannot do a push-up, whereas before I could do it. I cannot do a pull-up, whereas before implants I could do it. I cannot do a bench press or flies, but I was able to do it before. That's one of the most common symptoms in terms of muscle and joint pain. Another one is I find it very difficult to take a deep breath, especially when I'm exercising or when I'm laying in bed and the implant is sitting on my chest. It's very hard to take a deep breath. Some of the other symptoms are related to greater immune response. I have much greater food sensitivity, much greater chemical sensitivity than before. Or I have more rashes. I have more hives because I have become much more sensitive and immune intolerant as a result of my reaction to implants. So those are some of the complaints. Well, why do I get fatigue? Well, because your immune system is working very hard. Another is brain fog and anxiety. Well, anxiety is very interesting because really anxiety is when the inflammatory mediators reaches the brain and the brain becomes inflamed. You know, brain fever is anxiety. I have heard that many times before from neurophysiologists. When you have heard of depression of chronic illness, well, there is anxiety of chronic illness as well, or anxiety of chronic inflammation.